Well, so I'm hearing from you that there really are very few medical conditions that people can turn to and blame their, let's say, putting on too much weight, and that most of the time there is just what you said, that excessive intake versus output of energy. What about things like medications? Are there medications that people may be on that may contribute to weight gain?
It's a huge problem. In fact, one of the things I do, and some of my patients here in the audience could testify to that, is that many of the neuropsychiatric medicines, many of the pain medicines that we use, many of the neurological medicines, medicines for seizures or for chronic pain, are inherent weight promoters. And so you have a patient who's got an injury, such as a leg injury or a back injury, who's immobilized by this, but is also in pain. And then the double whammy, they're put on medications for that condition, and appropriately, but then they have the effect of the drug, which promotes the weight gain. So one of the roles of a bariatrician, a medical weight specialist, is to review the list of medications that an overweight patient is on and to try to optimize it. Can we substitute a weight-neutral drug for one that's weight-promoting? In the case of diabetes, that's a huge issue. There's many ways to control blood sugars, all the way up to using insulin. But many patients who already are obese are put on less than optimal diabetic regimens that are more weight-promoting than weight-neutral or in fact, promoting weight loss. So what I do in many cases, not just for my overweight patients and obese patients in my programs, but for my diabetics and general medical patients, if there's a weight gain, I try to optimize it. I also think it's important that we start to warn patients about certain drugs. Many of the SSRIs, like the drugs in the Prozac family, can cause weight gain. Not in every patient, but if you don't warn a patient that, gee, you're going to go on an SSRI and it may increase your appetite, watch yourself, weigh yourself, be careful. We don't tell patients that. Before you know it, it's 50 pounds, and people are scratching their heads.